Listen up. There is one spot on your body that most men never think about. And when you give it the right attention, it can help bring back the confidence you thought was gone for good. I am not talking about your penis, and I am not asking you to do a complicated exercise routine. I am talking about a small, overlooked area that holds surprising influence over blood flow, sensation, and yes, your ability to get and keep an erection that feels strong and reliable. I am Dr. Jocelyn, urology and men's health expert. Quick heads up before we begin. I have linked my 2 favorite natural supplements for erections and stamina in the comments. They are genuine game changers, and I will explain why at the end. And stay with me because what I am about to share can change the way your body responds, especially after 50. Here is the honest picture of what happens to many men with age, and it is not your fault. Erections are a coordinated team effort between your brain, your blood vessels, your nerves, your hormones, and your pelvic floor. In your 20s and 30s, that team often works like a well-oiled machine. After 50, some players slow down. Blood vessels can become a little stiffer and less responsive, which means they do not open as wide or as quickly. When you need a surge of blood for a firm erection, it can be delayed. And once it gets there, it can be harder to keep it where you need it. Testosterone, the hormone that supports desire, drive, and tissue health, usually drifts down gradually year by year. You may not notice the slide at first, but your body does. Nerve endings that carry pleasure signals from the penis to the brain can become less sensitive. So, what once felt electric now registers as just okay. And then there are your pelvic floor muscles. These deep muscles help trap blood in the erectile tissue during arousal. But like any muscle, they can weaken from disuse or lock up from stress and guarding. When they are not doing their job, you feel it. The good news is that your body is more adaptable than you think. Even after 50, you can wake up these systems and regain reliability. You do not need gimmicks. You need to give your body the right inputs and a calm, repeatable cue it can respond to. That is where a simple, natural tool comes in: castor oil. Castor oil is not a miracle cure. It is a traditional topical oil with a unique fatty acid called ricinoleic acid that people have used for generations to soothe tissues. When used externally and thoughtfully, it can help calm low-grade irritation, soften over-tight areas, and support a more relaxed, receptive state in the tissues you care about. When you massage it into the right place, you encourage local circulation. You remind muscles to let go and then engage properly. And you reestablish a clearer mind-body connection in a region many men ignore until something goes wrong. The spot that matters most here is your perineum. That is the soft area between the scrotum and the anus. It may seem like an odd choice, but just under that skin lies mission control for sexual performance. The bulbospongiosus muscle and the ischiocavernosus muscle run through this zone. Together, they help push blood forward into the erectile bodies and compress the veins under the tunica so blood stays where it needs to be. Branches of the pudendal nerve travel here, carrying arousal and pleasure signals to and from your brain. Arteries that feed oxygen-rich blood to the erectile tissue pass nearby. This is not just skin. This is a control center. When you give this area a warm, careful massage with castor oil, you are doing something useful. You help clenched muscles relax so they can contract properly later. You encourage the small vessels to open and deliver more blood. And you gently wake up nerve pathways that may have gone quiet from years of tension, sitting, or stress. Men who notice weaker morning erections or who lose firmness too quickly during intimacy often benefit from bringing attention and circulation back to this center. You are addressing the root environment, not only the symptom. Here is exactly how to use the technique tonight in a safe, simple way you can repeat. Begin with a clean, dry perineal area. Choose a pure, cold-pressed castor oil with no added fragrance or chemicals. If you have sensitive skin, place a small drop on your inner forearm and wait a few hours to make sure you tolerate it. Measure about 1 teaspoon of oil. Warm it by rubbing it between your hands for 15 seconds, or place the spoon in a bowl of warm water for a minute so the oil feels pleasantly warm, never hot. Find a comfortable position. Lying on your back with knees bent and feet flat works well, or lie on your side with knees slightly tucked if that is easier. Place a warm, oiled fingertip or the pads of 2 fingers on the perineum. Use slow, steady circles about the size of a coin and short front-to-back strokes. You are aiming for firm, reassuring pressure that lets you feel the muscle beneath the skin. But you should never feel sharpness or pain. Keep your breath slow and even. Inhale through the nose and let your belly soften. Pause for a beat, then exhale longer than you inhaled. That longer exhale helps your nervous system shift out of fight or flight and into a state that allows vessels to open and muscles to let go. If you tend to clench down there, think soften on each inhale and allow the pelvic floor to drop a little. On the exhale, add a very gentle lift as if you were stopping the flow of urine, but keep it subtle and never hold your breath. That soft drop and lift sequence retrains the area to relax and then engage in the right order. Continue this massage for 2 to 3 minutes. There is no need to rush. Let the warmth and the movement do the work. When you finish, place a warm, damp towel over the perineum for 10 to 15 minutes. The combination of heat and oil helps the tissues stay relaxed and can further encourage blood flow. Evening is a great time to do this because your body is winding down and the calm can carry over into sleep, which itself is crucial for hormone rhythm and next morning energy. Repeat this routine most evenings for 2 to 4 weeks and pay attention to the small signs. Some men feel a gentle warmth, a slight tingling, or a sense of aliveness in the pelvic area within a few days. Others notice changes more slowly. With consistency, you may see steadier morning erections, better staying power during intimacy, and a deeper sense of confidence in your body's ability to respond. Remember, this is not like swallowing a pill. You are retraining systems and restoring pathways. Each body responds at its own pace, and that is normal. You may also notice unexpected benefits. Many men report less tension in the lower back, easier bladder control, and a comfortable sense of ease across the pelvic floor. The nerves and muscles in this region are connected. When one part functions better, nearby functions often improve as well. If anything feels uncomfortable during the massage, reduce pressure, shorten the session, or take a night off. If you feel pain, numbness, or significant changes in urination, see your clinician. Do not use castor oil on broken or irritated skin. It can stain fabric, so use an old towel and underwear you do not mind marking. If you take blood thinners, have a bleeding disorder, active hemorrhoids, a skin condition in the area, or significant pelvic pain, check with your doctor before you begin. Support this work from the inside out with simple daily habits. Stay well hydrated so blood can move freely and tissues remain supple. Eat leafy greens and beets, which naturally support nitric oxide, the signal your vessels use to relax and open. Include healthy fats like extra virgin olive oil, salmon, and walnuts to support vessel flexibility and hormone signaling. Move your body every day. 2 or 3 strength sessions per week and a daily walk improve endothelial function and insulin sensitivity, both of which matter for erections. Protect your sleep window so your body can repair and your testosterone rhythm can peak in the early morning. Lower stress chemistry with a few slow breathing cycles during the day. Longer exhales help turn down the sympathetic brake that interferes with arousal. Be thoughtful with pelvic floor exercise. Not every man needs strong squeezes. If you carry tension, emphasize relaxation first, and consider seeing a men's pelvic floor physical therapist if you have pain, pressure, or chronic tightness. Treat persistent erection changes as information, not a personal failing. If morning erections have faded for months, or firmness is often unreliable, ask your clinician to check blood pressure, fasting glucose or hemoglobin A1C, blood lipids, medications that might affect sexual function, mood, sleep apnea risk, and a morning testosterone level when appropriate. Addressing these drivers, along with a calm, consistent routine like this one, is the most reliable path to improvement. Think of this as an environment upgrade. Oil, slow circles, easy breath, optional warm towel, then lights out. Give yourself a full month of consistency and watch for the quiet wins. More ease in your body, clearer arousal signals, steadier firmness, and a calmer confidence that comes from feeling your system respond again. Your body knows how to heal and adapt at any age when you remove friction and give it the right cues. Let me close the loop on how this fits with natural supports men often ask about. Organic watermelon extract, rich in L-citrulline, feeds the nitric oxide pathway and can support blood flow, which many men find helpful 30 to 60 minutes before intimacy or training. A well-designed performance blend that combines Icarin, Tongkat Ali, fenugreek, nettle root, and citrulline is intended to support circulation, stamina, testosterone, and prostate comfort as part of a broader lifestyle routine. These are not shortcuts, and they do not replace sleep, training, or medical care, but they can complement the habits you are establishing in the kitchen and the gym. You can find the links to these supplements in the description below. Thank you for watching. See you in the next video.